The BLS is arguably one of the most important skills that anyone, even a bystander, could have. So this is basic life support, and what you want to do is you want to follow this method called Dr. SABCD. So memorize that mnemonic first. So we're going to start off with danger, response, send for help, airway, breathing, CPR, defib. So you're going to start off with danger, and you only have to list 3 dangers. I like to talk about bloods, sharps, and electricity. Then what you're going to do is you're going to do response. And in response, what I would like you to do is I would like you to yell in both ears, "Can you hear me?" And you can also use the cows method if you want to do that. But it's easier to say, "Can you hear me?" So do it in their left ear, "Can you hear me?" Do it in their right ear, "Can you hear me?" And then feel both arms going down. And the reason why we do this is because sometimes you can have unilateral loss of sensation. So we're checking that both sides are actually impaired. And so what can end up happening is you can have an unconscious person, but maybe they are hearing you, but they're not able to respond. And hence, that is why now we're going to be sending for help, because this is quite concerning. And now we're going to be checking their airway. So in order to check their airway, what you want to do is you want to do something called a pistol grip and keep one hand on their head. And just pick a side. I usually always go to the patient's anatomical right side, as this is often the traditional way and the standardized way of doing clinical skills. However, you could go on to the left. I think it's just better to practice everything on the right hand for all examinations. Therefore, because in a clinical setting, the key differences from normal to abnormal are very small. So hence, we need to keep a standardized method so we can kind of feel out and trust our intuition on finding those differences. So try to go on the right side. But again, so pistol grip with your right hand, left hand on the forehead. Please do not open the mouth fully or push the head back and open that airway. The reason for that is because if there is an obstruction, let's say they choked on something, by you opening that airway fully, you've just forced that obstruction deeper. So you want to open their mouth with a pistol grip, not pulling back the head fully, and check for the obstruction. Please verbalize no obstruction in mouth. That's more than enough. Then you want to tilt the head fully back, still with a pistol grip. And now the reason is different. The reason for the pistol grip now is that if your fingers are basically covering the soft palate, or if your fingers are basically on the throat, you will fail the station, because what you're doing is you're actually obstructing the airway. So what you want to do is you want to pistol grip the mouth and make sure your fingers do not touch the throat at all. And you can even verbalize that. Then you want to look for 5 seconds, and you also want to feel their chest with your hand. So I do it with my right hand, and as per COVID guidelines, not too close to the face, but just enough where you can hear their breathing, and then verbalize not breathing. Now we move on to CPR, because they're not breathing, they're not responsive, blood is not being pumped throughout the body, so we need to circulate that blood. And the best method is to do something called the caliper method. Please know it has to be with your index finger and your thumb. Doing it this way, where the thumb is on the clavicular notch, your index finger needs to be on the clavicular notch. And then this hand's index finger would be on the xiphoid process, and your thumbs would be halfway through the sternum. And that's where you would then rest your left palm, and then have your right palm on top of your left palm, doing your 30 compressions and 2 breaths. I think most people do get the compression deep enough. However, they just forget, or they don't count in the heat of the moment. So instead of counting from 1 to 30, just do 1 to 10 times 3, 2 breaths. Obviously, when you do the 2 breaths, make sure you cover the mouth in this C type formation. So one hand like this on the mouth, and other hand like this, using that one-way valve. And then you're gonna do that. Usually they make you do it for like 2-ish minutes. So you do this 4 times. And later at the end, when let's say the paramedics come, you need to verbalize that patient was seen unconscious, you checked their airway not breathing, you did CPR, how many rounds of CPR you did. So this is what considered 1 round, or you can even say like, I've been doing CPR for 2 minutes approximately. I would like to put the patient on an ECG stat, And you can say that at a year 2 level, maybe at a year 1 level, you just describe what happened to the paramedics and what you did. And another thing that a lot of people forget is actually sending for help. This is very important. There's a button in each examining room. So actually go and click the button with your hand. Only then does it count. You can also tell the examiner, I would also get a bystander to dial 000. So now the AED has come. The first key step is to place the AED on your side. Don't have the AED on the other side of the patient. I've seen this so many times. That will fail the station if you do that. So they might intentionally even put the AED on the left side of the patient. So pull the AED over to your side. Don't get up and go to the left side. I mean, I guess you could, but I'd rather just pull it on my side. Turn it on first. Don't place the pads first and then turn it on. Turn on the AED, place the pads. They can even ask you what the placement is. So remember, one pad is mid-clavicular, mid-axillary. I might be wrong about the mid-clavicular part, but essentially it's under the clavicle and near the midline of the clavicle, and then mid-axillary on the side. Please remember that for infants, one pad in the front, one pad in the back. And now basically the machine is going to start analyzing. You need to verbalize stand clear analyzing rhythm. And then the machine will say shock advised and it will start blinking. The yellow button will start blinking. So you need to say shock advised looking at patient. This is because when you shock in real life, the patient's body will actually shake. And so you need to see that contraction of muscles because that actually confirms that the shock actually went through if you were to do this in a real situation. So you're going to verbalize shock advised looking at patient. Then you're going to verbalize about to shock before you click the button. And then while clicking or like right after you've clicked it, you can say shock delivered. And please remember that when you are doing the shock delivered, you're not looking at the the AED, you're looking at the patient. And that after, I think, after the shock, it won't say anything. Obviously, if the patient doesn't come back, you will just resume CPR in a real life situation. As per exams, you just resume CPR right away. They usually make you do it for like another minute, and then the AED will like scan it another time, and usually by then the examiner will just say, okay, stop. Even this video, we've gone to almost 8 minutes. So around this time, they'll say, stop. Can you tell me 3 things that you would tell the handover team? Something like that. Another thing that I forgot, which actually is one of the biggest reasons why people might have to redo the station, is that their tempo is too fast. And this is due to multiple reasons. It's your first time doing BLS, you're really nervous. It's the first time during the MSAT. You have this examiner literally marking you and determining your future score of MBBS 1. So I totally get it. But you want to make sure that the pace is around 60 to 80 beats per minute. The song Staying Alive is really good as it gives you a really constant pace, and you can even sing it while doing your chest compression. So that's going to give you a good kind of rhythm to follow. I can't play it because I'm going to get copyrighted, but search that up.